First thing I'd like to say to everyone is thanks for saving my life. Y'all did this, whether you know it or not. I was born in 1950, and about the age of 15, I started smoking. I was raised on a small farm in southeast Missouri, and almost everyone smoked at that time, including me. And as life went on, I smoked more and more, and by the time I was probably 40, after spending time in the military during the Vietnam War and stuff, I was probably up to 2.5 packs a day, sometimes 3, which is not a good thing. We'll find out later, you know. But life goes on, and finally I had some heart problems in 2005, and around 2006 I quit, which was a hard thing to do. It's very hard to quit smoking. It's probably one of the hardest habits to break there is. But anyhow, y'all implemented the low-level CAT scan screening for lung cancer, and Tracy came home from work one day and she said, "Dad," she calls me Dad, by the way, she said, "You really need to get one of these." And I said, well, it probably wouldn't be a bad idea, but I put it off a week or two, as people do, and she finally convinced me that I probably needed one, and I was going to visit my family doctor anyway, so I asked him if I could have one, and he said, "Yeah, we'll schedule you for one." So I went down and took one of your low-level CAT scans, and sure enough, when I come back, Dr. Yusuf called my family physician and said he's got a spot on his right lung that looks like lung cancer. That was a very small spot, thank God. And my doctor called me and he recommended a PET scan, and I came back to your office, had a PET scan, and sure enough, it lit up, and they were pretty sure it was lung cancer. So my doctor recommended a surgeon, and I went to him, and thank God Dr. Yusuf said, well, he didn't recommend a biopsy because the spot was way high in this right lung. He said, "Why don't you do a wedge biopsy?" At that point, they did a wedge biopsy, and they took the nodule when they went in, managed to get it, and they found just a few cancer cells outside the nodule. So they said, well, we really need to go back in there and take the upper lobe. So they did that 4 weeks ago. And when they got the upper lobe out, the rest of it and some of the lymph nodes, they found no more cancer. So with your low-level CAT scan, I'm standing here in front of you after approximately 2 months from the time of the low-level CT, cancer-free. I would like to thank you, Dr. Hicks, and everyone involved, you know, for probably saving my life, where I might get another year or 2 out of this old body, you know. I didn't take very good care of it, but it does belong to me, and I have to put up with it now, so, you know, we go from here. But anyhow, thank you all very much for taking care of me and finding this in time. I will tell you one more thing. The oncologist told me that the lung cancer they found is only found in smokers. They have other types of lung cancer, but this type is only found in smokers. And it's a very fast-growing type, because I asked him, I said I had no symptoms. And I said, well, they would have probably showed up a couple years down the road. He said, no, within a year, you would have probably been a stage 3 or stage 4 lung cancer. So, thank you.